Hi, Dana Phillips, family nurse practitioner here with all things nurse. Go ahead and subscribe to my channel for content on real life nurse advice. And today's video is going to be about my favorite book references and resources as a nurse practitioner. And there'll be links in the video to purchase these books on Amazon. So the first two have to do with psychiatry. The first one that I love is this little pocket book, Psych Notes by D.D. Pedersen. This I use on a daily basis at my geriatric psychiatry job. And it has all these wonderful tabs, but my favorite one are drugs A through Z. And it gives specific geriatric dosage information. But wonderful book, wonderful tool. The next psychiatry book is Clinical Psychopharmacology, Made Ridiculously Simple. And the author is Preston Moore and Johnson. And this book reads more like an actual book and very interesting stuff. It delves very deeply into the different classes of psychiatric medications, not necessarily things that you would be able to find quickly when looking things up in like an app like Medscape or Hippocrates or something like that. This definitely goes in depth, very good read. And it's small, short book. The next resource that I really love is for women's health. And it's this small book called Managing Contraception for Your Pocket, specifically 16th edition. As you can see, I have it tagged with all kinds of, quick go-to pages. But this book, the authors are Zyman, Hatcher, Allen, and Haddad. This book is super in-depth on everything contraception, goes through, everything you can imagine, contraindications, side effects, and what to do when one method isn't working, what to switch it to, what to avoid, that kind of thing. Great pick for women's health. The next one is for pediatric care. It is the Bright Futures little pamphlet. As you can see, I love books that are just easy and small and easy to throw in your bag and not too heavy. But this is the 6th edition Bright Futures Guidelines for Health Supervision of Infants, Children's, and Adolescents Pocket Guide. And this is from the actual American Academy of Pediatrics. I don't know about you, but if you're ever like, oh gosh, I don't remember what a toddler is supposed to be doing when they're 2 years old, like their different social, emotional, physical, motor skill kind of milestones. So this book makes it super easy. It goes through like each visit that you'll have in pediatrics. So like newborn visit, 2 month, 4 month, 6 month, so on and so forth. And then each year as a toddler and into childhood and adolescence. So it gives you anticipatory guidance. It makes it completely, foolproof. The whole list of every category of anticipatory guidance that you can imagine is in this book for every age range, and also all of the developmental milestones that I already mentioned. Great book. The last two books are good for the family realm, so for family primary care practice. The first book is the Practice Guidelines for Family Nurse Practitioners, 5th edition, and the authors are Fenstermacher and Hudson. This book is very simple to read, it's to the point, and it's well organized. You'll see that it goes by, all the systems, and in the systems, it will go through different assessment tools, diagnostics, things to look for in labs, and plan information for each diagnoses. I find that this book is just really easy to read and really easy to navigate. The final book in my list of favorite references is actually a dermatology book with really gross pictures. It's the Fitzpatrick Color Atlas and Synopsis of Clinical Dermatology 8th edition. Very graphic stuff to look at. And the authors are Wolf, Johnson, Saavedra, and Rowe. And so this book goes through every skin diagnosis you can think of. Each section is based on different categories like psoriasis, epidermal disorders, neutrophil-mediated diseases, sebaceous disorders. So it covers pretty much all your bases in dermatology, and each diagnosis is accompanied with a wonderful picture. And what I also love is it gives the textbook clinical manifestations like in the terminology. So things that you'll need to be adding into your documentation, like pearly, waxy, well demarcated, those kinds of words, like when you're trying to like think about how you're documenting different skin things and you're just at a loss for words, for adjectives. This book is a great reference, and you'll be like, oh yeah, great words to pull from. And it also gives you really great information about treatment options for each skin disorder. So like I said, you'll find all the links to the books in the comments below. So go ahead and like my video and subscribe to my channel for more nurse life advice content. Have a great day.